53 million caregivers manage healthcare for their family members. But how many caregivers do you include in your user research? Your best features are probably failing because you're asking the wrong people what patients need. And this gap between what product teams build and what users actually need is costing your company way more than you think in churn, support costs, and expansion revenue. So in this video, I'll tell you about the 3 biggest communication gaps between your product team and your actual users, why caregivers are the missing voice in your product development process, and the exact framework I use to help health tech companies bridge this gap so they can reduce churn, increase adoption, and finally build the features that people actually use. If you're a health tech executive that's watching adoption rates plateau or dealing with high ticket support volume from confused users, this video could change how you approach your entire product roadmap. Let's go. Your product team probably conducts user research by talking to doctors, maybe some practice managers, and running focus groups. But the people who are using your product every single day, like the caregivers who are logging into patient portals at 11 p.m. trying to figure out medication schedules or which vital sign threshold to track, and managing their parents' appointments across multiple specialists, these are people who are never in the room before product decisions get made. This creates design debt with a feature graveyard. It's a product roadmap that's full of capabilities that looked amazing during your agile product planning, but they have single-digit adoption rates in the real world. And if you have more than one doctor, whether you're a patient or a caregiver, try keeping track of all those patient portals. This is a problem that I see constantly with health tech platforms. You build a sophisticated care plan tracking feature, but caregivers are still using paper notebooks. You create detailed medication management tools, but they're taking photos of their pill bottles instead. You implement two-way messaging, but they're still calling the office. I work for some of the biggest names in tech as a UX content designer and work with lots of UX and product groups. And I was doing this remotely when I was taking care of my late husband, managing his primary doctor and his 9 specialists. That's 10 doctors with a very important UX job that all had to coordinate. And the reason my husband had so many doctors is because of his chronic conditions. But you don't know what kind of issues that family caregivers deal with unless you talk to them. Isn't empathy the first rule of UX design? When I was managing care coordination across those specialists, I was dealing with an RPM platform that was sending me glucose alerts, a patient engagement app with appointment reminders, a telehealth portal for virtual visits, and a medication management tool. But no 2 or more of those things talk to each other. Your product team can't solve problems unless they know they exist. As I mentioned in the beginning, there's 53 million family caregivers in the US who are managing someone else's care. These are not just caregivers, these are real people like me. There's someone's daughter trying to coordinate her mom's CHF between work meetings, or someone managing their partner's post-surgical recovery with your patient engagement platform while also handling their own job and the kids. The big thing that your product team needs to understand is that caregivers have completely different needs than patients themselves. When you design for the patient, you're usually designing for someone who might check their portal once a month or maybe twice, but caregivers are your power users who are in your system constantly. They're the ones who actually need your care coordination features because they're managing multiple family members who might all be using your platform. They need to access multiple patient records to coordinate between different family members who are helping with care. They need mobile access because they're managing this stuff while they're sitting in waiting rooms or during their lunch break. They need your integrations to actually work because they're coordinating between your platform and 3 other systems. And they need contextual help, not just data, because they're making major healthcare decisions without medical training. Despite all this, most health tech products treat caregivers like an afterthought, and that's if they account for them at all. I can't tell you how many times I had to log out of one portal and then log into another to be someone else so that I could coordinate care. That's not just a small UX annoyance. It's a fundamental misunderstanding of how healthcare works among family members. According to the U.S. Department of Health and Human Services, only 7% of patients and caregivers use a portal organizing app to combine medical information from different portals or online medical records into one place. So we need you to stop treating caregivers like an edge case. Your user personas are elderly patient with diabetes or post-surgical patient. But where's your persona for someone like working adult managing care for aging parent with multiple chronic conditions using an RPM platform. Where are they? Your customer success team knows that caregivers exist because they're the ones generating the majority of your support tickets. But unfortunately, in most companies, not just health tech, those kind of insights never make it back to the product roadmap in any meaningful way. When your product doesn't account for this reality, caregivers like me are going to find workarounds that are easier and completely bypass your beautifully designed features. We'll go back to phone calls, paper notes, and shared Google Docs to get the job done. And then you lose adoption metrics that you were counting on, expansion opportunities, and the champions who could be driving referrals to new provider organizations. Let me introduce you to a framework that I'm going to call the user reality audit. It has 3 parts that work together, whether you're building an RPM platform, a patient engagement tool, care coordination software, or any other healthcare SaaS. First, include caregivers in your user research, not as an afterthought. Sit down with the people who actively manage someone else's healthcare and watch them use your product in real time. You want at least 30% of your user research participants to be caregivers, and you want to specifically recruit people who are managing care for chronic conditions, because that's where your product either becomes indispensable or it just gets abandoned. And when you're in the user research session, don't just ask them something very broad like, what do you want or what do you need? Watch what they actually do. Watch how they use your product. Ask your customer success team to identify your most engaged caregiver users and your most frustrated ones, and then interview both groups. Track comprehension metrics, not just activity metrics. Most healthcare companies look at login rates, feature clicks, time in app, and those are all activity metrics. But they don't tell you if people actually understand how to use your features or if they're actually getting value from them. In addition to your activity metrics, you need to add comprehension checkpoints throughout your user journey. So after someone uses a feature for the first time, just ask them one simple question. Could you explain what this feature just did and how it helps you? If they can't, then you either need to adjust the UX design, the UX content, or both. So for example, I worked with an RPM startup who found out that caregivers were dismissing critical alerts because they didn't understand the term SPO 284% and what that meant in English. So I advised them to add one extra line for clarification, which made all the difference. This oxygen level is concerning and may need immediate attention. After they just added that one sentence, that one small change, their alert response rate went from 23% to 71% practically overnight. Remember, caregivers who are learning your platform are probably under stress. They don't have the adequate training to use it, and they could be in the middle of managing a health crisis. So meet them where they are. Third, create a caregiver lens review for every new feature before it ships. Before you launch, have someone on your team, ideally someone from customer success who talks to caregivers daily, do a role play as if they're a caregiver in crisis. They're managing 3 family members' care. They're doing this on their phone at 9 p.m. after work. They haven't slept well in a week, and they just got an RPM alert that seems urgent, and they need to figure out what to do right now. Just a short role play with all of this going on. Can they actually accomplish the things they need to using your product when they're in that state of mind? If the answer is no, or if it takes more than 3 taps or 3 steps in your product to get critical information, then you're not ready to ship. If you implement my framework, my user reality audit, you could see adoption rates increase by 40 to 60% within 6 months. And when you build features that are intuitive and actually make sense for the people who need to use them, it also improves your NPS because caregivers become champions instead of frustrated users that are creating workarounds. And thus, you'll also dramatically decrease your customer support burden. Now I want to hear from you. What's the biggest communication gap you've noticed between your product team and your users? Drop a comment below. And if you're serious about fixing this in your organization, I am here to help. If you need more help with this, I created the 5-day Health Tech SaaS Onboarding Optimization Challenge. It's a free email course where you'll actually rewrite your welcome email using my frameworks: the patient psychology framework, the ongoing value approach, and personalization strategies that help combat generic messaging. By day 5, you'll have your first onboarding email rewritten and a blueprint for the last 4 days in your sequence. This is perfect for product leaders, customer success heads, and founders who need to fix their onboarding before the next contract renewal conversation. Thanks for watching, and check out these videos next.